operation line where a baby is about to be born. In an Australian first, you will be there every step of the way, watching from home in real time. We are looking into Theatre 10 here at the Mater Hospital. The doors are opening from the anaesthetic bay, and our mum, Irini, has just had her spinal anaesthetic, which obviously means there's no pain, so that cesarean can underway, and that's all gone to plan. She is comfortable. You can see hubby James, he's been clinging onto Irini's hand very, very tight, as has her lovely obstetrician, Dr. Stephen Tan. So we're now bringing her into theatre. Let's have a listen.
Okay, bed's locked. We are good.
Nice.
Thanks, Ryan. You're good
Taking
there?
everything.
Everything stay real still.
Okay. Rolling.
David, your call, David.
Okay. All good.
Hang on.
Your hands on your chest there.
Yeah, I'm
You
good.
all ready? 1, 2, 3.
Thank you.
Excellent. Now we've still got a bag of fluid under there, I think, from outside.
Bed's going away. Yeah, good. Thank you, Pam.
Hold on your back's okay. Yeah, that's okay. Now you're all covered up. Don't worry, we've got a lot of things to do before we start, okay?
Well, you can see taking care of Irini is, on the right is Dr. David Bollinger, the anaesthetist. And Dr. Stephen Tan is in there. He is Irini's obstetrician. He will be conducting the surgery today, bringing little bud into the world. So before we get to that point, let's meet Dr. Stephen Tan.
Yes.
I'm Dr. Stephen Tan. I'm a consultant obstetrician and gynecologist, and I've delivered over 10,000 children over the last 10 years. Good morning.
All ready for you?
For 9 months, you have been so good.
Yes.
Once this kid's out, I want you to go crazy. I remember when my younger brother came home, holding him for the very first time, it was an amazing feeling. And when I was in kindergarten, my parents put me in a doctor's coat and a stethoscope, and ever since then I've been inspired to be a doctor. I've got 2 lovely daughters. Isabella's 14 years old and Charlotte is 13 years old. They were both delivered by a cesarean section, and it was a wonderful process to be able to be with my wife, not as a clinician but as a partner. It's truly a magical moment in time. Family, to me, is everything. The ability to have a wonderful wife, the ability to have children, it is amazing. I get emotional all the time. I have been known to shed a tear or two, but you must be the captain of the ship. You must be strong for your patient. Every moment that a child is born and every moment that a child is placed in the hands of a loving, caring parent is a proud moment for me.
You can see why his patients love him so much, Dr. Stephen Tan. Now, he is in charge of everything that's happening today here in Theatre 10 at the Mater Hospital in Sydney. We, of course, are guests in this incredible miracle that we are witnessing tonight. So let's listen in to Dr. Stephen Tan as the procedure gets underway.
All right, team, shall we do timeout? Okay. Danielle, timeout. We have Irini, sign, data, cesarean section, good. And she's allergic to penicillin. Thank you. Timeout's done, great. Holly, feel free to prep.
Okay.
It's gonna be okay. Good.
Nikki, the timeout then that Dr. Tan was just doing, explain what that is.
So that's something called a team timeout, and it is our final stop. Everybody stops what they're doing to listen to the timeout, and it's where we check the patient, we check their identification bands against the consent, we make sure that the consent is appropriate, is signed, we make sure that we've got all the equipment that we need in the room, including blood if we need it. We introduce ourselves if we don't know one another. We talk about the patient's allergies and ask if anyone has any concerns. If we're doing a surgery that involves a side, we'll make sure that we've got the correct side as well. It's our final stopgap. Mistakes have happened in surgery, and the team timeout is our final checkpoint to make sure that that doesn't happen.
Which is very reassuring. Irene's looking calm but nervous, as you would be when you are about to have a little bub. Speaking of nerves, I know that Irene's mum and dad are here, Con and Sophie. There they are, waiting outside with beautiful little Sophia. So that's Irene and James' little 3-year-old girl, so she's excited. She is just about to have a baby brother or sister. James looking a little bit nervous too. Guy, just tell me what's happening now with that sort of yellow stuff.
All right, that's the antiseptic solution. So they're painting the on which looks a bit like soy sauce, to be honest. But it's very effective and takes action over 2 to 3 minutes. Cleans everything off the skin, so it's completely sterile. And then the drapes we put on after that, ready for the surgery once Dr. Tan comes back in.
So now we know that the spinal anaesthetic has taken effect. Irene can feel nothing below where that went in. Are there a few tests that are done to make sure?
Yes, so prior to all this occurring, the anaesthetist checks with cold and or some slightly sharp points to check that all the regions are numb, but that'll be working very well because she would have felt that being freezing cold otherwise put on her tummy.
Okay. One of the things that we are most proud of celebrating is the incredible team that is around our patient and how everybody works so well together. This is about celebrating them. They really are saving lives and tonight bringing a life into the world. And I'd like you to see and meet the team and what they do.